Hi, this is Dr. Michelle Stafford here again with our podcast, Mixed Dentition. And my special guest today is Adrienne Koznek. Thank you for coming.
Thank you for having me.
And your business is Wy'East Lactation Support.
Mm-hmm.
And you are a lactation consultant.
I am, yes. I'm an IBCLC, which means that I'm board certified to provide expert lactation care for moms and babies and their families.
That is so wonderful. You have such a great job and so important. I just love it.
Yeah.
Well, I think we could start off talking about why breastfeeding is so important. I mean, I know we could probably talk hours about why it's so important.
Certainly, yes.
Maybe just give me like your top 5 reasons.
Well, I think for me personally, the things that I care about most when it comes to breastfeeding is a public health issue and the amount of positive outcomes that there are from babies who are breastfed and for the breastfeeding parent as well, and how much money the community can save and just global health-wise, like how much money can be saved from preventative diseases and all of that. And then I also believe really strongly in breastfeeding as the foundation of secure attachment. I think it's a really, really great way to have babies be bonded to their parents in a very important way. It's a huge like part of raising a securely attached child.
Mm-hmm. Yep, I couldn't agree more.
Yeah.
So thank you for all that you do for our families.
Yeah,
it's so important to have lactation consultants.
It's my pleasure.
Support.
It's such a joy to get to be able to like support families on such a tender time in their lives too. And there's so much going on, and their worlds are just rocked when you have a baby, and so it's a big honor and privilege to be chosen to support a family in that time.
Mm-hmm. So tell me exactly, how you provide support to new moms. Say it's their first time baby and she's just learning. I mean, I've been there. You're just learning how to nurse this tiny little human. And tell me how you provide that support to new moms.
So I think that we spend a lot of time planning for pregnancy and planning for childbirth, and we read all of the books about that, and we make these beautiful, amazing plans of how we want our births to go. And then we forget to read the breastfeeding books. I mean, I know I certainly did, for sure. And so then we're kind of thrown into it and learning how to do it while doing it. Mm-hmm. And that's not easy. And, breastfeeding it's natural in that it's a biological imperative that babies are born to do it, but that doesn't mean that it's easy, and it doesn't mean that it comes naturally. There's definitely a learning curve, and there's a real art to it. So how I support families when learning how to breastfeed is teaching them the basics of what good breastfeeding looks like and what it should feel like, and what are the signs that they can look for to know that their baby's getting enough milk, because that's definitely like the number one thing that parents worry about. Mm-hmm. Like I'm sure of it. That's on everybody's mind.
Right.
So providing those basics, and oftentimes my support comes by way of they're having problems. Mm-hmm. Something's not going right, breastfeeding is painful, they're worried about whatever. So then they come to me, and then I help them problem solve and strategize. What is the problem? I can help identify what the problem is, if there is one, and then how do we solve that?
Right.
Yeah, so that's where my expertise comes in, is knowing what good breastfeeding looks like, and then what are red flags in breastfeeding, and helping parents navigate kind of where they are with that.
That's great. So for new moms especially, can you give us a couple of what you called red flags? So, because I think there is a misperception, moms know that breastfeeding is supposed to be natural, and a lot of people out there are saying that sometimes it hurts and sometimes it's uncomfortable, and just get used to it, right? But maybe that's not the best advice. So
I think it's well intended, because I think that we all hear stories about breastfeeding being painful, and that you have to push through it and you have to tough it out and all those things. And pain is a sign that something is wrong. Mm-hmm. So I really stress the importance of being able to differentiate what is normal transient tenderness, normal soreness in the first week, 10 days max, and then what is beyond the realm of normal. And I would say that if you're having consistent, like persistent pain and soreness and tenderness beyond the first 2 weeks, then there's something that needs to be looked at for sure. Mm-hmm.
Mm-hmm. And what could some of those causes of that discomfort for moms be?
It's kind of Occam's razor. Generally speaking, the simplest explanation is usually what it is, which means the basics of the latch. So ensuring that the baby is latching well from the beginning is going to be the best prevention of soreness and pain with breastfeeding. So red flags would be if you're having continued sore nipple pain, that's continuing. If you're dreading feeds, that's a really common one. When parents say, I am dreading having to feed my baby next time, that's a huge red flag. Right. Breast pain, plugged ducts, sign of infection where it seems like you might be getting something called mastitis, which is a breast infection. Those are all red flags that ideally when the baby's first born, we can prevent those things. But if they're happening, then I come in and I help try to fix them.
Yes.
Yeah.
That's great. And where does tongue tie come into play, and lip tie as well? With
tongue and lip tie, those have a lot of signs and symptoms that's how I look for a tongue tie, is basing it on its signs and symptoms. And a lot of those signs and symptoms are things like sore nipples, nipple pain, nipple damage, and also signs in the baby too. Do they have blisters on their lips? That's a common one that I see that I feel like gets missed a lot. And I think that's one of those things that gets out there in the world as, oh, that's a normal thing for babies to have blisters on their lips. And it's not. And then is baby nursing for 3 minutes and then passing out, falling asleep? Right. That's another sign and symptom that I look at. That would be of concern as well. And then is baby gaining weight? If they're not gaining weight, if they're not having proper output, that can also be a sign and symptom related to tongue tie. But it can be a lot of other things too. So it's definitely tongue tie is definitely on my radar. I consider it to be something that's of particular professional interest to me. I am trained in how to assess and evaluate for it. So if a parent comes to me and says they're having these symptoms, and sometimes because they've talked to other parents or they've read on the internet or in Facebook groups and all those things, because we're talking about it a lot, they'll say, I'm concerned that my baby might be tongue-tied. And more often than not, I have a lot of parents say, this provider said that they weren't, or this provider said that it's a slight tongue tie. And so then I have to kind of take all that information and look at it and make my assessment based on my evaluation, and then refer out to the appropriate provider to then diagnose and treat it if necessary.
And that's where we can work together.
Yes.
Where we come into play.
Yeah.
Because, of course, at World Smiles, I do a lot of tongue ties for infants because I feel so strongly for nursing babies. But I also think it's so important that we look at nursing as multifactorial.
Absolutely.
Because when I have moms that come to me who've self-diagnosed the tongue tie off the internet, I'm quick to emphasize that they still need to see a lactation consultant because, releasing the tongue tie in and of itself may not correct the nursing issues. And, baby may have habits of a shallow latch, and just so important to see someone like yourself in order to make sure that mom and baby have that wonderful dyad and are able to nurse together well.
Because that's exactly it. It is a dyad, and I say this a lot with parents who have breastfed babies in the past, and they're on their third baby or whatever, they say, oh, I breastfed before. And yes, that is great. That's not nothing to have that own knowledge for yourself on how to breastfeed, but the baby that you're carrying has never breastfed before. So sometimes there can be some practice that needs to go into teaching this baby how to breastfeed. And especially when it comes to tongue tie, they've been using their tongue in compensatory ways since before they were born, right? In utero. They're using their tongue in a way that is not that will not be conducive of proper breastfeeding. And so it doesn't end with just releasing a tie, because then they have to physically retrain their tongue to be able to remove milk appropriately and efficiently. So that's where, lactation consultants, we're the expert in the latch. So that's where we come in with that.
Yeah. And I think that's so great. And I emphasize with parents, the in utero thing is so great about it. Their tongue tie has been since
Right.
they were created.
Yes.
In utero, and so just releasing it, it's a muscle that needs to be strengthened, and
Yes.
so they need to work with baby in special ways in order to strengthen that muscle, to get a better latch, in order to have a better relationship. So.
Yes, and I do all of that as well, especially after, if a baby has their tongue tie and or their lip tie released, that I always recommend that they come back for a follow-up, because I can help work through those exercises to really strengthen the tongue. And then I'm also a really big fan of pediatric chiropractic care for babies too, so I refer out for that for pretty much every baby I see.
That's wonderful.
Whether or not they're tongue-tied.
Yeah, I think that's great too.
Yeah.
I've taken both my children to a pediatric chiropractor, and just to make sure they're all aligned. And I think it helped with not just breastfeeding, but as they grew with growth and development, and that's a whole nother topic.
It totally is. But that's a nice little addition to our collaborative team. Absolutely.
Definitely.
Yeah, I'm a big fan of it.
I agree. For any pregnant moms out there with their first baby, what advice can you offer?
There is some research that shows that prenatal breastfeeding education is related to breastfeeding duration rates, like longer breastfeeding duration, which is a challenge in this country. We have great initiation rates, but we really struggle with continuing to breastfeed for the recommended amount of time, which from the American Academy of Pediatrics, it's a minimum of 1 year is what's recommended. So I think that getting that prenatal education is really important. So just kind of learning about the breastfeeding, the importance of it, right? And how it's this biological process and all the ways that it can help your baby and yourself. I think being empowered in that knowledge is half the battle, right? Just kind of knowing that and knowing what to expect, I think, and then what normal newborn nursing looks like. Managing those expectations of what it looks like in the first 2 weeks. So that's kind of where I might stop it for a pregnant parent, is say, just kind of look at the first 2 weeks, because then the rest of it, that's for future us to worry about.
And Adrienne, do you offer any classes?
I do offer prenatal consults, Great. So that can be an individualized one-on-one appointment, and I really recommend those for parents who maybe had breastfeeding problems in the past and want to kind of figure out how they can keep that from happening again. I mean, as you know, tongue tie can be, we do often see it in subsequent babies. It is hereditary.
It is genetic, yes.
So
definitely.
sometimes parents say, you know, my baby was tongue-tied before, and so there's a chance this one might be, so I want to be prepared. So we talk about things like that. If you also have a history of low milk supply, I also really recommend prenatal consults for that too, because then we can potentially get to possible reasons why you had low milk supply and what we can do to prepare for that, and just kind of managing what that might look like. And just, you know, in this country, we go back to work very, very early after having our babies.
So
and sometimes we have to prepare for that while we're still pregnant. And I can help. I think that it's common for parents to think that they have to stop breastfeeding once they go back to work. And I don't think that those things are mutually exclusive. So like part of my job is to help combine the working and the breastfeeding like together to make it possible for it to look however that parent wants it to look.
Right. Oh, I think that's great to talk about that too. Yeah. It is something in this country I don't think we talk about enough. And
no.
I pumped for a full year for each child.
Right.
And I had one of my team members, she was pumping, so we set up a little pumping station for her. And
that's awesome.
I have a couple more women that are out on maternity leave, and I hope to encourage them when they come back to continue pumping and giving that, you know, that gold milk to their babies, because it's so important.
And having a supportive employer is huge and definitely makes a difference on breastfeeding duration rates. It's in companies' best interest to support their breastfeeding parents, which is like a whole nother topic, but but it's great to be able to offer those things and to be able to support parents when they come back to work, because it's not nothing.
Right. And it's so important. I mean, it keeps the babies healthy and the parents healthy. And there's just so many positive aspects of nursing. And like you said, it's really society, if we can really get back to, you know, putting babies on the breast. Society will be healthier.
Yes,
so
it's taking a cultural shift, and I think that we make a lot of progress, and I think we still have a long way to go.
Great. So now for any families out there looking to find you, please tell us your name of your company again and the website.
So it's Wy'East Lactation Support is my private practice, and my website is wy'eastlactationpdx.com. I'm also cross platforms on social media, so you can find me there too. And I have office visits at a clinic called Mindtree Holistic Counseling and Wellness. It's over off the Sylvan exit on Highway 26, so it's pretty easy to get to. And then I also, in addition to the office visits, I also do home visits in the Portland and surrounding area. And I am in network with Regents Blue Cross Blue Shield, so I'm able to take that insurance. And then I also offer sliding scale for families who are utilizing OHP.
Oh, that's wonderful.
Yeah.
Well, thanks for being on the podcast, Adrienne.
Thank
really
you.
Appreciate you.
Yeah, thanks for having me. Thank you, and you as well.
Thanks for everybody who's out there watching, and remember, fill the world with smiles. Now we just laugh awkwardly. So
I know.